So let's get started. I just want to say hello to everyone. I'm Georgia Pomaki. I'm coming to you from the unceded traditional territories of the Coast Salish people. And welcome to our October webinar on return to work processes for workers with mental health conditions, a practical guide that is put together by the Canadian Society of Professionals in Disability Management. I'm very excited to have you here. A couple of words about me just to start. I'm the Director of Mental Health Best Practices and Mental Health Specialists at Manulife Group Disability Benefits. I have a PhD in workplace mental health and also sit on the board of directors of the Society, a Canadian Society of Professionals in Disability Management. I'm also the chair of the Mental Health Committee of the Canadian Life and Health Insurance Association and an instructor at Pacific Coast University for Workplace Health Sciences. Before I introduce you to our expert speaker, just a couple of housekeeping items, and I won't take long, I promise. For this session, you will receive one continuing education credit. You will receive a Zoom email in the next day or so confirming your attendance, so keep an eye on that, out for that. So our speaker will take about 30 minutes, and during this time, please refrain from adding any questions in the Q&A. Once Ellen has completed her presentation, please start adding your questions or comments in the Q&A. Just check the Q&A, not the chat. I will monitor both just in case, but the Q&A is where we would like you to add your comments. So let's not waste any time. I'd like to introduce you, very, very excited to introduce you to our speaker today, Dr. Ellen McEachen. Ellen is a professor and director in the School of Public Health Sciences at the University of Waterloo. Her research examines return to work, vulnerable workers, precarious employment, and the changing nature of work. Her recent edited book, The Science and Politics of Work Disability Prevention, provides an international picture of social security systems, work, and health. Dr. McEachen sits on the Labor Market Information Expert Panel for the Labor Market Information Council of Canada, which is a federal advisory committee that provides independent advice on labor market policy and practice, and is past president of the Canadian Association for Research on Work and Health. I've known Ellen for many years, and I'm a big, big fan of her work, which is both practical and based on sound research, which is something that we so need in our field of disability management. I had the honor of being a member of a diverse advisory panel for the research that she will be presenting about today. So I'm very excited to hear Helen share the very informative, insightful, and practical research findings. And here's the microphone to you, Helen.
Okay, thank you so much. I'm so pleased to be here today, and I'm so glad that you're able to moderate it, Georgia. Makes it more fun for all of us. So I'm just going to share my screen and get everything going now. And I'll just do full screen. Okay, and then I'm just going to, okay, there we go. So is everything working okay at your end?
Yeah.
Yeah,
perfect.
Okay, great. All right. So yeah, so thank you for having me present here today. My presentation is called Return to Work and Mental Health, Practical Lessons Learned from Return to Work Coordinators. And this is a study that was based at the University of Waterloo, and that I conducted with colleagues Elena Niederman, Katja McKnight, Cindy Malachowski, and Megan Crouch. So our study was focused on the specific challenges for return to work among people with common mental health conditions. So in this presentation, I'll mainly focus on telling you about how we created our return to work and mental health guide and what's in it. I'll also briefly address the business reality of return to work, which intersects with how return to work coordinators are able to do their work. I'll begin by addressing some of the context of our study. So in many jurisdictions, especially in North America, return to work has tended to focus on physical injury. In Canada, workers' compensation systems have mostly only recently started to accept that common mental health conditions such as depression and anxiety can be a workplace injury. So for instance, in Ontario, where I'm based, the workers' compensation system had been recognizing traumatic mental stress, which is what would occur in a robbery. But only in 2018 did they begin to recognize chronic mental stress as admissible. Although as far as we understand, very few claims submitted for this condition are actually accepted as valid. So because of this focus on return to work practices tended to focus on things like functional abilities. So for instance, in our jurisdiction in Ontario, return to work paperwork is focusing on questions like how much weight can you lift? There's been quite a lot of research in Europe about mental health and return to work, because mental health is being accepted in their insurance systems for a long time. But in Canada and in our own systems, we need to learn a lot more about the actual process of how return to work works when someone is off work for a mental health condition. So the focus for our research was on how return to work coordinators manage mental health and return to work. There is an emerging literature on return to work coordinators, such as these 3 papers here, led by Mark Corbière, Caroline Dua, and Hadi Khorshid. But this literature mostly takes a best practices focus. So that means it's focused on return to work, what return to work coordinators should do ideally. So while there are many things that return to work coordinators should do, it's realistic to assume that with the complexity of return to work, they're not always able to follow ideal practices. So for instance, in this image here, you can see the many different parties that the return to work coordinator has to deal with and try to get to agree with each other when implementing return to work. So we've got the worker, the insurers, the workplace parties, including different parties within that group, the employers, supervisors, union representatives, and healthcare providers. So this brings us to the question that drove our study, which is, what are actual challenges related to return to work for people with common mental health conditions, and how do return to work coordinators manage them? We had 2 main study objectives. The first one was to tap rich return to work coordinator frontline experience, their actual day-to-day experience of supporting return to work for clients with mental health disorders. And the second one was to create a strategies guide that could be used by stakeholders to help them with return to work. Our sample consisted of return to work coordinators from across Canada. And given that people doing this kind of work have a variety of different formal titles, we found the coordinators by asking this question: do you manage return to work as a part of your professional role? And so to be included in the interview, they also had to have experience of return to work for people with common mental health disorders, such as depression, anxiety, and addictions. So we found that these return to work coordinators worked in 4 main contexts. They worked in-house in large companies. They worked for consultants who provide return to work services to other companies, to small and large businesses. They worked for workers' compensation boards and also for insurers, including private insurance companies that also provide return to work services to their clients. Now, all of these return to work coordinators are people who are accountable to and who report to employers. So to include return to work coordinators with a worker orientation that was a bit stronger, we also included union representatives who support workers during the return to work process. In the end, we gathered a total of 47 semi-structured interviews, and each interview lasted about 1 hour. The interviews were transcribed verbatim and analyzed inductively using thematic analysis. And if anyone wants to know more about that, you can ask questions at the end. So the interviews were conducted in 2018, so they're pre-COVID, and they don't include the COVID mental health context. Just before I describe the study, I just want to mention that our study was funded through a competitive grant competition with the Workplace Safety and Insurance Board grants funds in Ontario. And just their legalese is that funding for their guide doesn't imply their endorsement of the guide. An important aspect of this guide is that it was guided from start to end by our stakeholder advisory committee, composed of insurers, workers, human resource professionals, legal advisors, and labor representatives who provided, and each of them provided advice and feedback on the study all the way through it. And you can see Georgia, his name there too, and she played an important role on this committee. So our thematic analysis of our data, of our interview data, led to the identification of challenges and strategies for managing mental health cases in 3 key contexts. So the first is the work context, which were return to work strategies that include workplace parties such as supervisors and co-workers. The second is the health context, and that includes health and healthcare. And the third is the claims context, which address communication strategies for facilitating work absences and compensation claims. So there's a picture of the guide that we created. You can see the front cover of it. And it's called Roadblocks and Alternate Routes, Practical Strategies for Managing Mental Health and Return to Work. So by roadblocks, we're referring to return to work problems that commonly come up along the way, as described to us by the coordinators. And by alternate routes, we mean ways of managing those problems. So all of the content of the guide was created through our study, and the guide was also validated in 2 subsequent workshops with return to work coordinators who gave us advice about the content of the guide and also about how best to present the material. And our stakeholder advisory committee also provided detailed input on the guide. The guide is intended to be used by a wide range of users. So for instance, workers, employers, insurers, unions, and more. And most of the advice is deliberately quite specific, not tied to sort of the policies of one jurisdiction. And it's been downloaded by people around the world. And it's available to be downloaded for free, and the link is here, and I'll also have it at the end of the presentation. And I'll be sharing my slides after too, so you don't have to rush to write it down. So the guide is 60 pages long, and I can only give you a summary of it in this presentation. But what I'll share first are the guiding concepts in the guide, as you can see on this slide. So basically, 4 main points: that there are unique challenges and opportunities with return to work and mental health. The concept of objective medical evidence that you might be using more in physical situations is difficult to apply with mental health. There are aspects of people's minds and lives that are very difficult to measure. And DSM diagnoses are made through clinician interpretation of self-report instruments. With return to work, we often focus on functional abilities when planning return to work, but that's not always possible. For instance, someone with a mental health condition could be seriously ill, even when they're not presenting as sick. So for instance, they could be engaged in intense physical and social activity, which we don't often associate with being ill, but they could be quite ill at the time. And also people with the same diagnosis may display symptoms differently. So altogether, the key strategies in this guide are focused on listening to the worker and understanding their work context. So yeah, the guide is laid out in the 3 sections that I mentioned: the work context, the health context, and a claims context. And a physical version of this guide is also available, and it has tabs for the 3 sections. And if anyone would like the physical version, I do have copies available if you contact me. So I'm going to start off by taking the work context as an example. Here's the table of contents for common return to work issues that came up that related to workplaces. So here we get into 10 common return to work problems, beginning with workplace mental health literacy on page 12. So you can see we have workplace mental health literacy, interpersonal workplace relationships, workplace communication during sick leave, workplace support of accommodations, employers' understandings of recovery timelines, workers' concerns about return to work, the fit of accommodations, workplace flexibility, health problems after return to work, and psychological health of the workplace. So the work context was definitely our largest one. And each of our three main sections, excuse me, work, health, and claims, also begin with vignettes. And the vignettes are illustrative scenarios that show the reader what roadblocks are developing in a situation and what alternate routes might be taken. So here is an example of a vignette in the work section of the guide, and I'll read it now. So May used to be the social butterfly of the office. So several colleagues took notice when she stopped planning social gatherings and avoided opportunities to converse with coworkers altogether. After an outburst at work with a colleague, May took sick leave. Before she left, she had been showing up late for work and often left team members to finish her work at the last minute before presentations to potential clients. Although a few of her good friends had initially defended her behavior and said she was going through a tough time with family, when she failed to return their calls of concern, they stopped trying to call altogether. During the 4 weeks that May was away from work, no colleagues called to see how she was doing. In return to work planning meetings, May worried about coming back to work because she feared the judgment and the fallout of her past behavior. She was nervous about seeing her colleagues and didn't know what to tell them, which only compounded her anxiety. So we also include a few. You can see that on the left, we included 2 roadblocks here relating to interpersonal communication and relating to workplace communication during sick leave. And we also have a few alternate routes on the right, asking a coworker about the best contact approach, talking with the worker about their concerns and needs, and including the worker in return to work planning. So on the actual pages of the guide, all of these are expanded on. They're not just bullet points. So I'm going to move in to show you one of these roadblocks, interpersonal workplace relationships, just to show you what that looks like. Now here we go. So here's a roadblock from the work context called interpersonal relationships. And I'll just read the top paragraph just to show you how the problem is described. Workplace absences for workers with mental health conditions may be preceded by a period of poor work performance. Workers who feel that they perform poorly may be apprehensive about returning to work out of fear of being stigmatized or due to unresolved interpersonal issues with their supervisor or other workplace parties. As a result, even if a worker appears medically able to return to work, they may resist returning, and after a return, they may feel uncomfortable about the situation. So I won't read the rest of the page, but you can see that we propose 3 different alternate routes as ways of getting around the roadblock. For instance, one is about talking about with workers about their needs. Another is bringing in more people to help brainstorm the problem. And a third route focuses on mental health literacy in the workplace. And just to give you an idea, I'll show you the table of contents for the health context and the claims context too, just so that you get a sense of the range of topics that we covered. So in the health context, starting here with page 35, we talk about accessibility of healthcare providers for mental health conditions, content of sick notes, quality of medical evidence, worker engagement with mental health care services, medication use during return to work, and communication with healthcare providers. So we describe each of these and provide alternate routes for managing them. And just to give you an example of the claim context topics, here's the next slide. Working with diverse stakeholders, difficult decisions, complexity of mental health cases, health information for adequate case management, difficulty communicating with workers, and addressing the workers' expectations about the timing of return to work. So that just gives you just a sense of the overview of the guide and some of the topics in it. I'll turn now to the second part of my presentation, which addresses the business reality. So although the goal of our study was to understand return to work coordinator experiences of managing return to work, in keeping with our focus on practical realities, we found that it was impossible to ignore the business reality of return to work, as it made a difference to what return to work coordinators were able to do in practice. So basically, as we conducted the interviews, we became increasingly aware that return to work coordinators are not independent operators. They are also employees with managers and performance targets. And their organization's performance targets might claim or aim to align worker health with profit. But in some situations, the ambiguity, where there is ambiguity, the business needs could take over. So this business reality contributed, we saw, to return to work coordinator burnout. We heard a lot from coordinators about distress in relation to conflicting mandates of health and business in some cases. So in the next slide, I'll share some practical examples. So in this and the next slide, we have some quotes to very briefly illustrate examples of the business realities that came up in our study. For each of the quotes, the names provided are pseudonyms because we protected the anonymity and confidentiality of the people who we interviewed. So return to work coordinators told us that a key focus for their organizations was to achieve recovery of the worker and also minimal disability duration. So basically the shortest work absence. And so for instance, one of the people we interviewed, who we called Amelia, said it's all about claim duration. That is, return to work coordinators were there to help the worker recover, but their job also involved reducing the claim costs. This is where some return to work coordinators described a tension between economic needs of the worker and health of the employer and health of the worker. So as that Shannon put it, she said it was a fine balancing act between the company's needs and the employee's needs and the expectations of workers' compensation, because we're having to juggle all of these things. And in the company, we want to keep our insurance premiums down. We want to keep our ratings up, and we want to be in good standing. So what struck us on the research team was that the employees' needs were definitely mentioned, but they sometimes seemed overwhelmed by other things like insurance premiums and the business's good standing. Another business reality related to caseload. And the issue here was that the return to work coordinator sharing with us that mental health cases took more time than the physical ones. But this wasn't always considered in their caseloads when they were allocated cases, meaning that if it wasn't considered, they would often struggle to adequately manage mental health cases due to the intense time pressures of these cases. And a fourth issue was the nature of the work. It definitely involved very positive encounters when they helped workers to recover, and that was very rewarding for them. But it also sometimes involved difficult, highly emotional encounters, such as when communicating claim denials or the inability to support further time off of work. And this comes through in these quotes. So for instance, as Jennifer described, she said, I deal with a lot of crying people. It's really hard sometimes. And another one said, often we have to give the messages that they don't want to hear. I've said to people, this is not a job if you want to be everybody's friend. So this is where the burnout comes in. Coordinators talked about very high turnover in their business as a result of difficult tensions that they had to balance. Now, definitely the ones we spoke to weren't burnt out because they actually were there as coordinators still working to talk to us. But they talked a lot about peers and everyone around them. So for instance, one return to work coordinator said to us, when I first started, a colleague told me, you're not going to last. Anyone who sat next to me is left within the year, which is true because there have been people who get into this line of work and they find it a bit too challenging. So I'll turn now to the summary and conclusions. So in the first part of this presentation, I shared how our study identified complexities associated with return to work for people with common mental health conditions. We assembled a detailed return to work and mental health guide that addressed important roadblocks to return to work progress and provided ideas for alternate routes to manage these problems. So the key messages in our guide include listening to the worker and understanding the work context, which sounds simple, but is a lot more complex than that. And again, here's the link to where you can download the guide. The second part of our presentation focused on the overlap between workers' health and the business's economic concerns. And we shared some examples about how the business side of return to work exerts an influence sometimes on the return to work process. Our study is focused on very practical issues relating to return to work. So with that goal in mind, we suggest that more transparency about the business side of return to work might improve practices and build stronger relations of trust between the ill or injured workers and among the involved parties, and might reduce some of the tension faced by return to work coordinators. So this brings me to the end of my presentation. And last but not least, I'd like to thank the many return to work coordinators who so generously shared their experiences with us and allowed this study to happen. Thank you.
That's fantastic, Ellen. Thank you very much for giving us such a just an efficient overview of the research that you conducted. I'm just for anyone who's kind of curious about this is the actual physical guide, and Ellen was generously offered to send you a copy if you're interested by contacting her, which is I highly recommend. And I do want to note that just each of the areas, the work, the health, the claims, it's just worth I think a webinar on its own, so there's just so much in each of these. Another comment I wanted to make is what I really liked about this guide is that of course, the research team went to the source, people like all of us today in this webinar who are working and with people and helping them recover and return to work and got the information straight from the source. And then really appreciate the complexity of the work. And it's not about a problem and a recipe or a solution. It's more about identifying all the different issues that are actually quite interconnected and identifying options of how to address them. There's no one thing that anyone can do for each problem, but there's probably a constellation of things depending on what's realistic as well. So I really appreciate that, because that's oftentimes research is it's difficult to do to really capture all the nuances just as a factor of the methodology of research. But your research methodology really allowed for a more realistic representation of the issues and the solutions. And I found that was particularly helpful and for all of us in the field. A couple of other things I wanted to note is I really like how you talked about listening to the worker, that it starts from there, which I think is very, very important. And how we each have our own reality. We work in our own workplace, dealing with the issues that we have. But the guide and the research really opens up the view. And sometimes we don't realize certain things that we see because we just, we just have our view over here. But this guide really opens up the view and tells us, oh, maybe these are some of the issues that you're also having in the workplace, and just notice them and become aware of that. And these are potential solutions that you can choose from if that's feasible for you. So I think that's, I find that also as a great contribution of the research.
Thanks. I mean, a key aspect of it was to try to make it really practical. There's so much out there about what you should do. Everyone should do this and that. And we wanted to find out about what practicing return to work coordinators actually were able to do. And yeah, that was a key focus for us.
So I would like just see that there is quite a few questions here. So from the audience. So I'm just gonna kind of try to put them together as much as I can. Just I think maybe a clarification from you, Ellen, first. Tell us a little bit more. Somebody's wondering about the presentation of employer-based return to work coordinators, because I know that you had a lot of those folks in your sample.
Yeah.
And also in your advisor, but also in the workshop. So just to clarify a little bit this, so that it's clear for the
Yeah,
audience.
and I can see the questions here too, so I'm just
Oh,
reading.
perfect.
Yeah, so the human resource managers were there to represent the employer's perspective. That was sort of our aim, is they'd be the people in organizations who'd be acting on behalf of, like, the employer isn't directly managing return to work or involved in it. But the people in human resource management are, and so that was who was on our stakeholder advisory committee to manage that aspect of it.
Yeah, thank you for that. So I think we'll put the link in the chat. I don't know if, because I don't have access to the link, but if you can do that, and maybe just at the end, so that we don't interrupt now. But we can put the link in the chat where the guide can be downloaded. And if you can remind us where you can obtain the copy of the guide, somebody is interested in that.
I'm going to put the link in right there. We go. I think I tried to put the link in here. Type the answer. Paste. Send. Well, we'll see. Yeah. Might have to send it after to everyone.
Yeah, maybe if you put it in the chat, because I think this might be only for the individual who asked.
Oh, that's why. Okay.
Yes, as far as I understand. Yeah.
Okay.
We can put it in the chat so everybody can access it.
Okay.
Yeah. And the question about how they can obtain a physical copy of it.
Okay.
So contacting you, maybe you can add your email
My
as well.
email. You know what? I'm not able to paste in the
chat.
In the chat for some reason. Yeah. So maybe one of you amongst, like, Georgia, you have the copy of the slides.
Yes, I will do that.
Someone else who has it could do that and put that information.
Well, let's go to another question then. One quick question is whether the guide is the 2019 version or is it updated?
It's the same one. There's only one. Yeah.
Yeah. It's still very valid. All the points are still, we haven't resolved all of the issues yet.
Yes.
It's an ongoing reality. And I think with the pandemic, probably, and maybe that's a comment on that, is, do you think the pandemic has, how does that kind of inform the guide or the research findings?
Mm-hmm.
Okay, so any suggestions on how to approach a worker who doesn't want to divulge details of the condition or any workplace issues?
Yeah, I just saw that, and I was just looking through our guide. We definitely have that as an issue that's addressed, and basically, well, with more, because the worker is not obliged to share their actual medical condition with the return to work coordinator. Now, many return to work coordinators have that information if they work with workers' compensation or the insurance force, because they have access to those files, but other ones don't. And so how do you manage it? It does make it a little more difficult, but on the other hand, it's not as if knowing the diagnosis will help many return to work coordinators, because many return to work coordinators don't have the specific training in that issue anyway, right? The professional training. And so the idea is just to ask them what are their barriers and how can you help? It does make it harder. With their permission, you might be able to speak to coworkers or managers as well and find out more about workplace issues. But you just have to work around it. And also you can start work to gain trust. Often I would think that those conversations might be like that if there's not a lot of trust. And so there can be ways to demonstrate trust and to build a relationship too, just by showing them, making small steps and showing the worker how you're actually helping them, right? Step by step.
Mhm. No, that's a great approach. Yes, somebody noticed that the chat is disabled, and I'm not able to add anything there either that anyone can see. But in the Q&A, if you go to answered, there is the three tabs, open and answered. I believe there's two of them, and that's where you can see the guide link that Ellen, and it will be available on our member site as well. So all the slides will be available on the member slide, on the member site. Okay, so there's another question here about, thank you for presenting, which is great, I agree. Somebody's struggling managing return to work plans with employees returning from leave with a mental health injury. Is it lack of support from the insurers? You touched on insurers wanting to stay in good standing. I believe that was also employers wanting to stay in good standing with their premiums. Is having a negative impact on the employee success in returning to work. Mental claims are being treated as per disability duration guidelines. When each claim should be managed on an individual basis, how do we get past that? How can we have insurers provide a more supportive approach to return to work for employees with mental health issues?
That's a great question. And mental health literacy is at the root of that. So you have organizations that are expecting return to work coordinators to manage a certain caseload of however many, depending if they more, usually so many of the return to work coordinators we're working remotely and never were able to physically see the worker or their workplace. We were very surprised by that. But they had larger caseloads as a result because they didn't spend time driving back and forth. But anyways, so getting back to the caseload issue, we need organizations to understand that mental health cases take longer. And it might be hard. It might not seem like a catastrophic injury that requires a lot of time, like someone who's been in a car crash and broken their spine and whatever. But mental health claims do take longer. And so organizations need to start giving people enough time to manage those claims. So I think that is a key thing. And then in the question, the issue of disability duration guidelines came up, and that was an interesting topic that we sort of saw in the study, in that with physical health conditions, there are pretty well established disability duration guidelines. But I would say that for mental health, I don't know how well developed that is. And certainly for the return to work coordinators who we spoke with in the study, they were definitely dealing with things on a case-by-case basis, and just trying to sort of manage the workers' health, and also not let the claim go on forever. But I would say one of the key things is organizational support of return to work coordinators and giving them the time that they need for these cases.
That's perfect. I also noticed that in the guide, collaboration is a very important element because there's a lot of stakeholders that are trying to help the worker with their recovery and return to work. And so I would say the guide I've seen as say, if you have, one of the stakeholders is maybe not as collaborative or is not providing the service they're supposed to, is to reach out and basically discuss the issues and ensure that everybody's work is on the same page. Because I've really seen that throughout the guide about the collaboration among the different stakeholders. So it's about finding solutions. So if something doesn't work, then we really need to sort it out, reaching out to different stakeholders.
And that definitely, and another aspect of it is that the solution this week might not be the same as the solution next week, right? And so just being aware that things will change and being receptive and ready to adapt when needed to. Yeah.
I have one question for you, Ellen. So you talked about how mental health cases or individuals with mental health conditions may need additional time from the return to work coordinator. And I wanted to ask you um, about that. What would be potential reasons for that if you saw that in your research? Because one thing that comes to my mind is the professional backgrounds of a lot of return to work coordinators, and whether we have the right skill set to really feel confident in, you know, dealing with these issues.
That's a really good point, Georgia. The professional background, and I have a slide for it. I just don't have it handy right now because we do have a slide showing the professional background. And I would say, you know, the majority of the people had some sort of health training of a background, but only some had the type of health background where they would actually have interacted with patients before. Some of them just had more sort of training. And some didn't have any health background at all. The most extreme case was someone who'd been a travel agent previously, but that was just an outlier. And so yeah, it could be that the background, that the people didn't have the background that was needed for that because they were mostly familiar with physical. When it was described to us, it was about well, I think when I think about it now, I think it's more anxiety, people maybe with anxiety conditions, just needing more phone calls, or more reassurance, more contact, that sort of thing.
Yeah. Just looking at, there are a few more questions from in our chat. So on the Q&A, in the on the topic of medical, providers are often not providing enough information about workplace accommodation needs, leaving this matter up to the workplace party to figure out kind of on their own what they need to do without their guidance. Does the study cover how to overcome this barrier specifically? Accommodations.
Page 37.
That's fantastic.
Sick notes. That was a big one. Basically, busy doctors don't have enough time to fill in these forms, and so put very little in them. And so what do you do, right? And so some of the suggestions, and the suggestions are all generated by the return to work coordinators as well, is by, you know, send the worker back to their doctor to ask them to get more functional ability information. So with some very specific questions to the doctor. Yeah, and if the worker and healthcare provider aren't aware of work accommodation possibilities, consider following up with the worker to discuss alternate job positions and what they might entail, and give them enough information on that so that they can bring that information to their doctor to make an informed decision. And finally, it's possible that the healthcare provider does understand that the accommodation possibilities, but nonetheless, they're still recommending an extended sick leave duration. And so the worker should follow up with their healthcare provider to seek information about specific recovery and return to work needs, and share this with their manager, return to work facilitator. So these are just some of the ways of managing that. It's a big one, and we have other sort of roadblocks that are sort of slightly related to that. Another one's called communication with healthcare providers that details a whole other layer of that, and some other suggestions too.
Oh, that's excellent. And were the communication with the healthcare providers, is it about picking up the phone, or is it about should the return to coordinators be calling the healthcare provider if it's possible?
Well, the problem here is that doctors don't have time to discuss workplace accommodations. They don't have time to fill in details. And so the return to work facilitators can help the worker to explain to the healthcare provider that their input is really needed for their situation, and their clarification is appreciated. So it's the one thing is it's difficult for the return to work coordinators to contact the healthcare provider directly. Often they don't have permission to, right? Because of
Right.
privacy issues.
Right.
But priming the worker, giving the worker the information, often, could be in a written format to go back to the doctor with, can help. Simple and accessible forms that are tailored to your workplace to be filled in, that might make things clearer and give the doctor a better idea about what specific information is needed. And if the doctor just isn't forthcoming at all, then you can ask the worker themselves what arrangements they need to safely return to work, what they think they need. And then another idea is that if you don't have access to the worker's doctor, but you do have access to some sort of advice, mental health care specialist around you in your team, in your workplace, you could ask them for general recommendations and resources that might support the situation.
Yeah, that's a good point, because sometimes a family physician might not be the most informed treatment provider regarding specific accommodations a particular individual could need, right? So reaching out to other specialist professionals, if the worker has them, is lucky to have them, then that might be a solution. Good point. Anything that you would want to add on the topic of accommodation, because it's a big topic and something that a lot of of our professionals, disability management professionals, are dealing with on a daily basis. Anything else from the guide that stands out for you?
Well, I think I'll tell a story, and it sort of went into the guide related to listening to the worker, but it was about someone talking about a worker who was really, they couldn't figure out how to accommodate them, and they kept like taking more time off and saying they couldn't do it. And then they sat down and talked to the worker and said, okay, let's look at your work and let's go step by step and see exactly what you're doing. And it turns out there was one step that they couldn't do and they needed someone else to do it. As soon as they figured out exactly what that barrier was, which wasn't huge to overcome, then the worker was back at work and off they went, right? But the worker themselves hadn't been very good about communication. They're basically saying, I can't do it, right? And so, but it was one piece of it that they couldn't do when they broke it down. So sometimes just having the time to sit down and listen and to go through all of the processes step by step can help a lot with accommodations. So that's one thing that we learned through all of the interviews.
Yeah, just being thorough in that process and creative, I guess. That's another piece. Yeah.
Mm-hmm. Yeah.
And thinking really about all the options and kind of being determined to find solutions. So that's what it sounds to me. I do have another question about the topic of interpersonal relationships, because you touched on it earlier in the in your presentation, and the example that you gave is not an atypical example. When we have struggled with our mental health issues, whether it's depression or anxiety or bipolar disorder or any other condition, post-traumatic stress disorder, our behavior changes. It's not a choice we have. It's something that is a part of the illness. When we get the treatment and feel better, we look back at how we behaved, and it's very difficult. It's a very difficult time for an individual, because a lot of the behaviors, basically they identify with those behaviors, and other people think this is who they are, but this was a time when they were ill. So that's it's a very vulnerable time for the worker, and it's very hard to explain to others about how that all works out within the context of an illness and recovery. So anything that stands out in the guide about, or the conversations you had in the workshops and during the workshops and from the different return to work coordinators, about how they experience that in their work, and maybe what is the approach we could have as disability management professionals when we have an employee who is returning, and we know there have been interpersonal issues while they were unwell.
Yeah. This is where workplace mental health literacy comes in a way. I mean, it's difficult because you have privacy issues. And also you don't want to stigmatize people. And we know there's still a lot of stigma around mental health conditions, right? So people are like, they know something was wrong, they know the person's off, and they're coming back. This is where general workplace literacy on mental health comes in. And so it's not specifically tailored to someone coming back, because then it links them so directly. But in general, just having seminars or information built into whatever, there could be monthly workplace wellness lunch and learns or something like that. And then you build that in just to have a bit of understanding. Another tip is having a buddy for the person when they come back. So, to have someone who they could trust, who they feel they can go to when things aren't that easy to manage. And that buddy could be an ally for them as well, socially, in situations like, let's go for lunch together, let's do whatever. So there are a few like very practical ideas throughout the guide on things like that, on an organizational level as well as interpersonal.
No, that's a good point, and I really like your point about having that the mental health literacy is not a one and done. That, as you talked about, it's something that we need to pursue on an ongoing basis. I know it's every organization has a lot of competing priorities,
Yeah.
and but we know that the mental health of our employees, of ourselves, your family members, is so important. Also for the health of the organization and the strength of the organizations, right? So I really like how you talked about that.
Well, I was just thinking, I was saying before that this is a pre-COVID research study, and I'd say mental health has only become more important since COVID, right?
Mhm.
And also depending on the types of work that people do, but like fears about COVID exposure, if you're doing public facing work, concerns about having to go back to an office if you've been working at home for a long time. There's a lot of there are a lot of additional issues now going on in workplaces compared to 2018, which makes it ever more important to be aware of these mental health issues and sort of incorporate them in return to work planning. Yeah.
Yeah, so it's the importance of both prevention and return to work intervention. Right? So
Yeah.
especially, yeah.
Yeah, I mean, this is definitely a return to work guide, but a lot of the issues in it could stand for physical as well. There's some very, very specific to mental health, and others are somewhat generic. But as we know, often even if the primary condition isn't mental health, if that's not the primary reason for their injury and being off of work, it can be an accompanying condition to a physical injury, right? And so it's just depression and whatnot. And so even if you're managing someone coming back to work for a physical condition, being aware of these mental health aspects could that's where the prevention aspect could come in. Yeah.
That's correct. Yeah. We have only a couple minutes, but I would like to there's one more question that I think we have time for, and that's about having complicating workplace issues and HR investigations taking place when also a worker has also a mental health condition. So if you have any comment on that?
So are we looking at the last one here?
Yes, the last one, yeah.
When there are workplace issues and ongoing HR investigations, and the worker provided medical, thereby medicalizing the situation, how do you manage the scenario? Do we know if there's more behind the scenes than just the medical? I don't know if our guide would have answers to a specific condition like this, but we do have the mantra of listening to the worker. And also there's going to have to be trust in there, two-way trust, right? And so sometimes these issues just aren't cut and dry. It's a matter of developing rapport, really spending a bit of time with the person to understand what their actual needs are. Does it need to be kind of litigious with documents and proof, or can it be a friendly arrangement where I'm helping you because I want you to get better? So it's relationships are at the root of so much of this. And that's where I would start is with relationships and a little bit of trust building, and then trying to go from there. Yeah.
Yeah, it sounds like it sounds to me that this is something that would apply equally to mental health and physical health, and how we, not need to necessarily treat those issues separately or differently. So trust is so important in our work as disability management professionals. It's the basis for everything we do, and without it, I think it's very hard to be effective in our work.
Yeah.
So listening and having empathy and understanding, so that we know what are the boundaries of our role. Sometimes there are certain things that we don't really need to resolve ourselves.
Yeah. This is the second return to work guide that I've developed. The first one was focused on complex return to work problems, and this one's focused on mental health problems. And I remember with the last guide, people saying, well, what are the local policies and what are the laws and why don't you have that? Because that matters so much, all of this sort of legal policy stuff. And we deliberately didn't put that in because at the heart of all of these things is communication. And so it doesn't really matter sometimes what the laws are. I mean, obviously the laws and the policies are critical and are there as an important context. But when you're developing return to work, almost more important is the communication. And that's why we've deliberately not created the guides that are focused on the specific jurisdictions, laws, and policies, but trying to get at the issues underneath that even, which is the communication aspects. Yeah.
So I would like to thank you, Ellen. This is such an insightful discussion. We can certainly go on for a very, very long time. And as I said, I think at the beginning that each one of the areas that the guide touches can be really a webinar on its own. So it's been a very, very insightful discussion. Great questions from everyone who participated. And I'd really like to thank you for your time and your generosity today.
It's my pleasure. I'm so glad to be here today.
Thank you. Thank you for everyone for your attention and your thoughtful participation today.
Okay, bye-bye.
Bye-bye.